Hello, everyone. This is Dr. Roy. I just wanted to revisit the PPE conversation in response to COVID. There's been several inquiries from the staff wondering if the rules have changed. So what I did, I went through and visited several websites to try to get an idea of what is legally acceptable, what is ethically expected of us, and what is the general temperature of the patients, not literal temperature, but hypothetical temperature of the patients, and what they expect their healthcare providers, including dentists, should do in regards to this. So I visited the Maine Dental Association. There's all kinds of resources there. The OSHA, Occupational Safety and Health Administration department website at the United States Department of Labor, the CDC, the ADA. You would think that there'd be clear guidance on this, as has been the most frustrating thing during the entire COVID process, has been the fact that there often isn't agreement in the world of what we should and shouldn't do. With that said, I have a pretty good idea what is expected of us in the bigger picture. So I do want to start with, I understand wearing masks it's a thorn in the side as somebody who struggles to breathe when I wear my mask. I get it. I hate masks as much as anybody, so I want to make sure that we always stay on top of the science so that we can get rid of mask wear as the science supports it. Unfortunately, I don't think we're there yet. And what I wanted to do was kind of share the rationale on where I'm at with this. Let me just turn off the baby monitor because the batteries are low. All right, so the CDC produced these categories, low, medium, and high, and they called it the community level risk assessment. Essentially, they have an algorithm that determines whether or not certain counties in the United States are at high, medium, or low risk. What's most important is these are more geared for whether or not you need to wear a mask when you go to the convenience store. These are not necessarily designed for dental offices or healthcare offices. With that said, they do tie in to some degree. So I'll come back to that in a minute. But you guys may have seen either on the news or in your emails these particular categories. But let's just start where Maine is. Maine is currently a mixture of different risk profiles. The more coastal areas are the more populated areas. Those are still at high risk. So we have to keep in mind that our recommendations are going to somewhat dovetail with the risk profile that you could find on all kinds of different websites. What does the CDC recommend with wearing masks indoors? Well, wearing masks indoors is a very different conversation than wearing a mask in a dental office. And unfortunately, the CDC and really all of the governing bodies have not been super clear on a dental office specifically. They kind of allude to indoors just being a general thing, and then they just say healthcare centers. But this final sentence that I circled in yellow, I just want to take a moment to read. This comes from the CDC. In the vast majority of cases, the CDC's new COVID-19 community levels recommendations do not apply in other healthcare settings, which include most dental facilities. So when you're watching the news and you see maybe your county went from high to medium or medium to low, that doesn't directly translate to what our responsibilities are as a dental office. This also comes from the CDC website. What are my options as a dental practice owner? So I have two decisions to make. I can either say, we are following healthcare setting guidances. There are state and local guidances in some areas of the country. In Maine, the state has decided to follow the CDC, so whatever the CDC recommends is really what we're not obliged to do. Legally, we don't have to follow these. We can follow the community level guidelines. But I think the public expects us to follow the healthcare setting guidance. So several of you have mentioned that you have friends that work in offices where they're following, I don't think they're necessarily following the community level guidance. I think they're just tired of wearing masks, and they updated their rules within their office, and they're not necessarily wrong, but if something were to happen, any litigating lawyer would say, well, you had healthcare guidance and you chose the community level guidance. So these two bullet points are two different categories of guidance. Where healthcare facility, if the CDC is saying, here are a set of rules that apply to you, whether they're actually legal rules or laws isn't the point. The fact is there's guidance. We're kind of liable in that respect if something were to happen. If somebody was to get sick and die, and they were able to trace it back to an exposure at the dental office, that puts everybody at risk. I take all of your lives very seriously. The last thing I want to do is for us to make a emotional decision because we're tired and frustrated with masks to end up putting the livelihoods of everybody involved at risk. So again, there's two different kinds of guidance. We are going to continue to follow the healthcare setting guidances, okay? Here's a chart. We're going to print this out and have this be our guide until the science changes. None of this is really new. Basically, it says everybody in the office needs to wear a mask. Obviously, when we're in the staff lounge, we can relax a little bit. Obviously, we need to be able to eat. Let's try to maintain social distancing where possible. I think we can be a little bit more liberal in the mask wear during the summertime. I'm not sure how this is going to change in the fall, but when we're in the staff lounge, just use common sense. If you think you're sick, please let one of us know and remove yourself from the staff lounge, or wear a full-time mask, or both. Okay. But moral of the story is, yes, we still need to wear N95 masks when doing clinical dentistry. That includes the hygienist, the doctor, and the assistants. Really, everything else stays the same. Here it says surgical mask is not required because a N95 mask is required. We are still utilizing the double mask technique. Wear your N95 that's custom fitted for you, that's been approved, that you know isn't going to translate harmful bacteria and viruses. And then over the top of that, you can wear a level 1 mask just to keep the splatter out and allow us to continue use of the N95 masks. What does change here is I am okay if we then switch out to a level 3 mask. So you can have an N95 for working on the patient, but when you're in the office, you can then switch to a level 3 if you're more comfortable with that. I don't know if anybody has been doing that, but based on the science, I am comfortable with us doing that. But as soon as you are sitting chairside and working on a patient producing aerosols, then we need to switch to the N95, covered within a level 1. Gowns, many of you are still not wearing your gowns. This should be second nature at this point. This should be like putting on a pair of gloves. There's no negotiations here. This is expected of us from the level of the CDC. I can promise you all it would take is somebody walking by an operatory and seeing an assistant and or a doctor not wearing their gown, a quick little photo that ends up on the news. We're all looking for jobs the next day. I don't want that. We have way too many cool things that we want to do for this world. Please, 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 please wear your gowns. So that's it. I hope everybody understands this is the world we live in. I wish it were different. It's not. But let's work together on making sure that we follow the guidelines. I will have somebody print these out, laminate them, and put them in the operatories. If you have any questions, thoughts, concerns, please email me with a separate email. I'm always willing to update our rules and perspectives as long as there's science to support it. The science is pretty clear right now. The recommendations are pretty clear. What I'm doing and what I'm following is basically what is expected of me as a business owner. So I wish you all the best with the rest of your Sunday, and I will see you later this week. Thank you.